And we're at 12:10, so welcome everyone. I'm really excited to have you here. My name is Denise Jackson. I'm the Executive Director for the Chicago Resiliency Network. At the Resiliency Network, we are collaborating with forward-thinking organizations who are meeting the urgent need of now to move beyond business as usual to think about how to build trauma-informed, healing-centered workplaces that are better for their employees and therefore better for their business. If you think about it, we're in concurrent pandemics. We have COVID, social justice issues. We have political unrest, destruction from natural disaster. And this is on top of all of the challenges, personal, family, and community that we were experiencing prior to the pandemic. And what's becoming more evident and is knocking at our door is that mental health is actually that next pandemic. So as we experience this period termed the Great Resignation, employers have a generational opportunity to adopt new ways to train their leaders and their staff members to be more resilient through these traumatic times, but also how their role as an employer can look at how to improve their business processes, their organizational strategies and procedures so that they can create cultures that allow them to recruit, retain, and advance their talent, and create environments where their employees can thrive so that they can win this war on talent now and in the future. So I'm really excited to introduce you to our panel, which I'll do in a second, but let's go through a few of the logistics for our program. So we're starting at 12:10, and we're due to end our panel at 12:45. We'll have a panel discussion. So I'm gonna ask questions, but please feel free to put your questions in the chat or to raise your hand and unmute yourself at the time that you can ask questions. After our session, we'll be swept back into the general room. And then if you're staying for the second session, then you can select the workshop that you'd like to participate in at that time. As I stated, you're all muted now. But please, if you're asking a question, unmute yourself. And then at the end, it's meant to inspire and inform you on what mental health practices can look like. At the end of this, we'd like for you to understand why it's important to build those trauma-informed, healing-centered workplaces for now and in the future. So I'll stop talking. I'm gonna start in introducing our panel. So we have Representative Felicia from AT&T, Rebecca from Rush, and Joe from Kentlar here. So could each of you introduce yourself, starting with Felicia?
Thanks, Denise. Excited to be on the panel with experts like all three of you. So my name is Felicia Latif. I am at AT&T. I'm in the HR benefits organization and a newly formed team called Total Wellbeing. Previously, we were the employee experience team or the wellness team, but Total Wellbeing expands beyond just your physical well-being into your emotional well-being and your financial well-being as well. So my responsibilities at AT&T are to design incentive programs to support our employees and their loved ones. I'm a liaison with our diversity, equity, and inclusion arm as well. I do educational workshops and work really closely with our benefits design team to identify gaps in care and employee populations that are impacted by trauma, by stress, by reduced income or other restrictions, and really making sure that we're reaching them where the need is in real time. So thank you for the opportunity to partner today.
Rebecca?
Yeah, wonderful. Echoing what Felicia said, I'm really thrilled to be here with you all and with the panelists and the leadership here today. My name is Rebecca Leahy. I am a licensed clinical social worker and psychotherapist by training, and I am representing Rush University Medical Center and Rush University System for Health here on the panel today. So I've been in the community mental health space for a very long time, working at the hospital and focusing on barriers to health equity and access for vulnerable populations. And more recently, Rush hired a chief wellness officer back in 2018, so pre-COVID times. And I've been working very closely the last 2 years with their wellness team, and I support the mental health team that's offering services, counseling, coaching, programming to Rush staff, Rush students, and then Rush residents as well, who have obviously been, adversely impacted over the last several years specifically. So very excited to, again, work with this panel and talk a little bit more about what we do at Rush as well.
Hi, everybody. I'm Joe Leupel. I'm with a company called Kintla. Kintla was founded by Dr. Bruce Perry, and it was founded to bring Bruce's work in trauma-informed care, resilience building, well-being to the workplace. And so we've actually used his model that's been used in schools and communities and found ways to bring that in a quicker way to adult populations and workplaces. And I'm a cognitive behavioral psychologist by training.
Excellent, thank you. So I am going to start with a few starting questions, and if there are additional questions, please enter them into the chat and I will definitely make sure that we answer them. So you each introduced yourself, telling a little bit about your organization and your role in your organization. But as it relates to mental health and trauma, can you please explain a little bit about your programs and the why behind your organization starting these initiatives? And I'll start with Joe, since you are in the training element, the why behind Kintla.
Yeah, so a couple things. So Kintla was founded to bring these tools to the workplace, and we've actually developed this toolkit that primarily focuses on bringing this neurosequential model to a variety. And what I love about this approach, it applies to so many different topics: change, culture, well-being, coaching, leadership. And what we find is if we can teach individual leaders, teams within organizations this toolkit, you can actually create an organization and teams where individuals within those organizations and teams have a better shot at building resilience and coming through really challenging times with better outcomes. And so I see this not only as interesting work to do, but it actually makes a huge difference in people's lives. So there's lots of whys. I could talk for 45 minutes on the whys behind it. But what I love about it is the uptake is quick and it has impact.
That's right, thank you. And Felicia, tell us the why behind AT&T being so invested in this effort.
Thank you. So the size and scale of AT&T, if we look at the US population and every individual that could be on our plan, extending to all of their dependents, we would cover 1/3 of the US population. So understanding the reach that we have with our benefits is significant. Over the years, it's shifted not from just equality, but equity and service. So with that, there's been programs that have been developed specifically to address Black, Indigenous, and people of color, and along with our traditional observances for mental health awareness. But understanding layered on with the pandemic, we also needed to have a little bit more immediacy. So hearing from employees about gaps in care for locations that they may live in, or being in the sandwich age where you're caring for older loved ones or for younger loved ones, so that on top of economic challenges, we needed to reevaluate our benefits, looking at not only what we're offering, but who are the companies that we're partnering with? Are they thinking about equity? And how quickly can we get these programs to our employees? And then also extending them to their dependents as well. Companies don't thrive if we're not thriving individually. So really in our leadership, taking a stance on offering programs that start with empathy and meeting people where they are at a personal level has been key to our strategy.
Excellent, thank you. And Rebecca, can you tell us a little bit about Rush's initiative, the why behind Rush starting these efforts?
Absolutely. So just as Felicia mentioned, in healthcare, we are focused almost always primarily on how patients are doing, on patient outcomes, on patient health. But unfortunately, we can't do a good job at managing patient health and promoting the excellence that Rush promotes if our staff and our students and our residents are not doing well. So Rush, 2 years ago, like I said, committed to, at the leadership level, to having a chief wellness officer who was going to support a Rush wellness initiative. Knowing that in healthcare, there is an increased stigma around accessing mental health services, although across the different settings that we're all coming from on this call today, there's stigma everywhere in terms of accessing mental health services, disclosing that there's a need or that someone is struggling. And so this was really key, I would say, the leadership buy-in in being able to get this started, but we actually opened the doors of our physical center where we offer psychotherapy, counseling, as well as coaching back in 2020. So July of 2020, right after the first wave of COVID and before the second wave hit in the fall. So we have been received very well by the community, but I think part of the why that we're trying to accomplish is destigmatizing and normalizing that it's okay to not be okay, and that we need to access our own wellness. We need to fill our cup first before we can take care of others. And as carers in the medical profession, that is even more important. But as we are dedicated to the work that we do because we're carers in general, but it's been very rewarding to see this grow and to have the community self-disclose how important it is to be able to name that supports are available and that it's okay to access them. So the why was more global, but it's become more acute during the crisis, as well as, Deneen, what you had highlighted earlier, everything else that's been going on in our world. And this is working in strong collaboration with some of the DE&I efforts that are happening at Rush in order to support and promote diversity, not only among staff and students, but also in reflecting the communities that we serve.
Absolutely. So both at AT&T and at Rush, you have magnificent programs that you're running, very innovative. So Rebecca, while you're on and speaking, could you just highlight one or two of the programs that stand out that have been so impactful for your employees, your caregivers, as you call them?
Yeah, caregivers in a sense. So I would say that the biggest service that folks are accessing is counseling, which was, I think, a surprise to all of us, not knowing how well it would be received or how much or how little folks would want to access this. But we're available across 18,000 employees and students in Aurora, at Rush Copley, at Rush Oak Park, and on the main campus. And so that is the part of our service that I think is most heavily utilized. And part of that is because we did promote not only normalizing and trying to destigmatize mental health conditions, but also we did promote privacy above all else, which I think is something that's really important. So while we work to get this normalized, we also need to honor that it still does carry a stigma. So we did a lot of work to ensure that folks could privately access this service. But in addition to that, I think part of our secret sauce is the programming that also accompanies the individual services. So we have a whole section of our Rush Wellness team that goes out to individual departments and offers talks and workshops. During the COVID-19 pandemic, we pivoted and rounded on the units and physically went to support staff who were frontline workers at that time, offering emotional support, sometimes a snack, which gets people talking always, and trying to make sure that people felt seen and heard. So even though we know that there's nothing we could do to control the pandemic, having people know that their wellness and their well-being is important and is valued was a really big part of the effort. So the programming is wider than that. And I think we do try to touch on themes that are important to the organization and to folks. And diversity is one of those that comes up quite frequently, wanting to honor that commitment that our staff have to that piece as well. But I think that's the individual, and then the more group level programming has been really helpful and successful at Rush.
Absolutely. And thank you again. We know our hospital workers have been under additional stress, so we know that it's extremely important keeping them in a good place. Felicia, at AT&T, there's some great programs that you offer also for your employees. There's so many, but if you could highlight a couple that stand out and have been very impactful.
Great, thank you. And such great programs to hear at Rush. Thank you for sharing, Rebecca. I will add that at AT&T, we do have a couple of on-site health and wellness centers. With us being global, it's a challenge to reach everyone in person, but it's been hugely impactful here at the headquarters to allow for private coaching. what was launched a couple of years ago is a well-being platform solution. So we incentivize all employees and their dependents and spouses to be able to go onto the platform, get informed about all of the resources that we have available, but that's just the platform. The programs specifically that have seen a ton of engagement are our enhanced employee assistance programs, where again, we extended it not just to you and your loved ones that are on your medical plan, but anyone in your household. So if you're a soccer mom, or you caring for your son who's on the football team, and they have a youth that needs shelter at your place, our care extends to anyone in the household. And it's not just for one session, it's up to multiple sessions. So we've increased the number of sessions for everyone that's within your household. And then a program that we recently launched is a resiliency program. And that's really helping employees looking at the stats, looking at the surveys. 42% of US population says that there's burnout and there's stress, and they've had some mental challenges as a result of COVID. So how do we solve for that? So we offered a resiliency program to help people identify their emotional triggers and to build additional skills in their tool set for when they need support. So again, on the behavioral health side, on the counseling side, and on the resiliency building skill set side. Those are three of our latest programs.
Excellent. Joe, so as an organization that's working with employees across the world, actually, can you share maybe some of the trends that you've seen where you have been providing assistance to organizations that stand out?
Yeah, and I think it piggybacks off of what Rebecca and Felicia talked about. Two issues jump out is coverage and scope. How do you get to more people? And Felicia knows that well. That's a huge challenge. And this idea of stigma that Rebecca highlighted a few times, she mentioned that, is sometimes when people see the toolkit, they say, how do we destigmatize it? So one person said, this is a nice side door if you talk about it as resilience. And I even think that word's getting worn out lately. So we often talk about it as, how do we handle stress? How do we create workplaces where we actually talk about stress? And also, how do we, and Bruce's research strongly supports that point. But the second point is building in more brief, positive interactions within your workplace. If you could do two things, it would be to build into your regularly occurring meetings a quick discussion about how we're doing from a stress standpoint, and to build in more brief, positive connections within your workplace to create stronger teams and stronger organizations. And we've seen organizations across the world start to embrace some of those and see these not as stigmatized, but these are good for business. And we've also seen that as well when we link both of those tools to driving performance. It's not only good for the culture, but it actually helps create better workplace. I was with the global team the last couple of days in New York, and that was part of the topic, is the fact the executive in charge of that group said, I'm just realizing how critical these brief positive connections are. And what happens is, because of that, reducing stress and brief positive interactions, it creates a space for people to feel supported if they're really struggling. So it's really to get ahead of that. And I think, Felicia mentioning burnout, I think the whole world is burned out right now. Is anybody tired of this stuff? Is this stuff getting old for anybody that's in this meeting today? And I think we can all say, yep, it's getting old for me. I bet it's getting old for all of us.
That's right. And one thing I failed to mention at the beginning is, at the Resiliency Network, we are a training cohort, and Joe is our partner as our trainer, and AT&T and Rush are members of our learning community. And so that's one thing that Joe reinforces all of the time, is the importance of positive interactions. Oftentimes when we hear from our managers or our teams, it's because of critical types of situations, not a regular engagement where you're building trust and building psychological safety, which is important. And
Deneen, one other point, I often ask people, it'd be interesting to ask people in your workplaces this question: when do you hear from your leader or your boss? I could predict what you're likely to hear, and I'll give you my top three answers. I've been asking this question for over 20 years. The number one answer by far is, when there's a problem or when something's wrong. The second answer is I don't. And the third answer is when they want something. And if we could flip that and say, I hear from my boss all the time. My boss has my back. We talk about lots of things. If we could simply change that, builds a great foundation to destigmatize what Rebecca was highlighting and to really get this to a broader group, not just people that are saying, I'm in a bad spot. Help us feel comfortable saying we're in a bad spot.
That's right. We want to create environments with psychological safety there.
Mhm. If I could add one piece to what Joe just mentioned, I think something that we see a lot when we do trainings with leadership is maybe a not so forthcomingly mentioned fear of leadership, of feeling like if I ask about this, I got to fix it. I have to know exactly what to do. But you don't have to be a mental health professional to be able to be attuned to the people that you're working with. And you also, sometimes we unintentionally invalidate someone by trying to jump to solutions too quickly. And so on a practical level, if somebody's coming to you with a problem, or if you're working with a leader has staff coming to them with a problem, sometimes just hearing and holding and saying, I'm going to look into that, or I'm going to think about that, is enough, even if there's not an immediate solution. I think sometimes we don't want to open that Pandora's box, but then staff are left feeling not seen and heard and not valued. So knowing that, and then knowing that we can also not be mental health professionals, but notice if somebody's different from their baseline and reflect that and connect them to the resources that are available, whether it's through their EAP or whatever it might be, that can be really powerful too. So I just wanted to build on that because it was a really important point that Joe made.
That's right. Thank you, Rebecca. So
Can we stay on this topic for a moment?
absolutely.
Such great dialogue. It's one of the things that can be hard, I think, when you're not the mental health professional or the expert, is, well, what do I do? How do I support my team member? So that's been one of the things at AT&T that leadership has really been encouraging, is that you don't have to have the answer. You don't have to be the expert. Your goal as a leader is to get them to connected to the resources and to be okay with having some of those uncomfortable conversations, but lead with empathy and compassion. So our leadership last year at the height of social unrest did a series of days of dialogue conversations, just come as you are, no judgment, and have conversations and share your experience and hear others out, and really just be okay with not being okay, and then providing resources for support. So equipping our leaders is really important, letting them know they don't have to be the expert.
That's right. Thank you for that, Felicia. Okay, so we talked about your programs, how wonderful they are, but to create them and get them moving couldn't have been an easy task. And so if you could just tell us about some of your biggest challenges or barriers that you've experienced with bringing these initiatives to the workplace, that would be helpful. And we can start with Felicia. Go for it.
Thank you. So Rebecca's probably familiar with this, and Joe as well. The data for populations that are impacted usually sits very separately. So it's a diversity, equity, and inclusion team versus a benefits programming team. So our teams had to partner differently and still within our EO, and making sure that our employees are protected, really understanding where are the populations that are not getting the support that they need. So that's one of the things that's going to take time. It's a shift, I think, just from a health administration's perspective. And then for the size and scale of our company, getting legal comfortable with the need for us to address the immediacy of where our employees needed support. It takes a long time to get new programs launched. So we had to go for it. And that usually is those are usually our hurdles. It's around data and how quickly can we launch, but leadership support makes all the difference.
I'm sure. Rebecca, do you have anything to add?
Yeah, absolutely. I'd say when I think about challenges to integrating mental health and wellness initiatives or services across any company, I think there's two things that come to mind. One is trust building or buy-in. And so we have talked about stigma, but it is important to name that without the trust of the folks who are going to be accessing the services, it's not really going to really launch. It's going to be a moot point a little bit. So trying to do whatever communication is required to have that buy-in and trust, again, putting certain measures into place. So at Rush, I mentioned that I don't know if that I've mentioned that the services are free. They're highly confidential. We put a lot of measures in place. So looking at your individual group and seeing what values they have and how we can overcome that is really important. Because we often hear that it's not bad enough yet, right? Like I'm fine, like that. This is for somebody else. I'm not at this point yet. But anybody who's in the mental health field, I'd much rather see you before you're in crisis, and I'd much rather do preventative work. And I think it can be meaningful in both ways. And the other piece is access. So ensuring that the services. So Felicia, you mentioned having certain locations, having physical sites. Having a hybrid of physical spaces as well as telehealth has been really helpful for us. And then recognizing the hours. We have a lot of third shift employees at a hospital. So keeping our doors open 7 a.m. to 7 p.m., not like a typical 9 to 5 has been helpful. But like I said, in each setting, that's going to look different. But access and buy-in, I would say, are two of the challenges that we tried to overcome.
Excellent. And Joe, again, you've worked with hundreds of organizations. So as you see different companies looking to bring wellness initiatives to their workplace, what are the barriers you've seen over the years with bringing this to light? And has anything changed lately that is either encouraging or discouraging?
Well, let me start with what's discouraging, and then I'll go to the talking points. I think so many leaders are at their wits' end right now because they're just full. They've been working at such a high rate over the last year and a half. So that to me is an uptick in trend. I've been getting probably 3 or 4 messages every week, the last 6 weeks, on people saying, I thought I had the tools to do this, and I'm out of tools, I'm out of tricks. And so where do we go? But I'd like to piggyback on it. And I love Rebecca and Felicia's comments. I do think it starts with leadership. And I think I think the question is, do leaders need to be experts? No. And I love that Felicia called that out. But they need to demonstrate this. And I think to Rebecca's point, they need to demonstrate that they can connect with people and that they're trustworthy. So start with that. And then I think for me, it would be the second point would be, how do we focus on the next simple thing to do? Because everybody's super busy. So if what we say is, oh, here's like an hour a day to add, like no one's going to do that. But if we say, what's the next simple thing I can do that might help, that shows that I'm trustworthy, that shows that I care. And I think for me, the roadblock challenges are how we measure this, how we follow up on this. And then I think the third point's really critical. How do we build this into our daily routines or our cadence or practice? Because it's the follow-up and the cadence is really the issue. And I know we're all sick of the word cadence throughout the last year and a half, so maybe routine's a better word. But how do we do this with some regularity and repetition? Maybe just bake it into a weekly meeting, some of this stuff, and then it's embedded in the fabric of your company.
That's right. So as you building on that question, what the challenges are, is there something that you wish you would have known then? What would you do differently that you know now? And whoever would like to answer first, please do.
I'll start with a quick one. I'm amazed at lean content applied over and over again and well. So the more I do this, the leaner the content gets. So that's why I went to 2 little things. I think I wish I knew to make it simpler earlier. And I think that's a good path forward for anybody that's wanting to get into this.
That's right. Felicia or Rebecca?
Yeah, I'll add not to underestimate grassroots efforts. Oftentimes we try to do things on such large scales and people need to connect one-on-one or in small groups to build that trust. And that's where we've seen the most success. So that changes the amount of events leaders are doing. They've expanded the teams that can support them. So making sure that those grassroots efforts are supported and that they have the resources they need to keep them going.
Yeah, I'm going to cheat a little bit, and I'm going to borrow from both Joe and Felicia. But I think one thing that came to mind as I was pondering the question, Deneen, is not stretching too thin and trying to be everything to everyone. So that kind of goes with Joe's concept of a lean message and trying to incorporate the work that we're doing into existing spaces that aren't going to be additive. But I think when in the hospital, when we first rolled out, everybody wanted a piece and everybody wanted a specific intervention for their team, and it felt different. And so we tried to pivot and be reactive. So I would say being more responsive versus reactive has been really helpful. And then also to Felicia's point, honoring what's already happening, right? So there's a lot of things that are already going on to promote diversity, equity, and inclusion, to promote well-being among employees and students. And we want to validate and include and align the efforts as much as possible. And it's hard to do, right? It takes a little time, but trying as much as possible to connect those dots. I would say that that's another really key point, and promotes that buy-in that I mentioned earlier too. If people feel like their efforts are being included and highlighted too.
That's right. Excellent. And then looking ahead, so partnerships are incredibly important. So are there ways that companies can work together, either with neighborhood organizations or with different trainers, or however you've done this? Can you talk about some of the partnerships that have been helpful for you to implement your programs?
I can start. So AT&T has arms for like Believe Dallas and Believe Chicago to work within the community to identify employees that are impacted, or the communities that we live in. Are we serving our community well? Are we good partners with them as well? And understanding trauma that they may be going through, either from homeless populations, just can drives, food drives, but leadership will go. I attended one to a session and met with people at a human level. Everyone's going through their own human experience, and meeting them where they are and acknowledging who they are. It's, again, grassroots, but it's very impactful. And knowing that we're here supporting them and that we're thinking about them as well has been key.
Excellent. And I see we have a question in the chat from Clifton. Cliff, do you mind coming off mute and asking your question? Also one of our CRM members from
Sure.
AMITA? Sure.
Yeah, so thanks. It's enlightening to be here and listening to the panel. So one challenge, as you all were talking about challenges that we found at AMITA Health, was we were asking ourselves, are we really offering the supports and programs and benefits that employees actually want? So we started our interventions at AMITA by surveying our leaders, our providers, and our associates about what they actually needed to feel good about themselves and their jobs. Because too often from higher up, we think we know what people need, but it's important to hear from the employees about what they are saying they need. And we found actually that there were cultural differences in what programs and supports different groups were looking for. And the access, as you all have said, the access to those supports was really important, and how to communicate that. We also felt that it was really important that those diverse groups were involved in planning and in helping us understand that although we kept saying we're all in this together, we actually were all in this in different ways. And the stresses that we and our employees were dealing with were different. And so it's important to meet the specific needs rather than to have one wide brushstroke across all populations and workers.
That's right. Thank you so much for that very insightful comment, Cliff. We're close to the end of our session. I think we have less than a minute. So I'm going to share my screen again. This team is very interested